Hello, welcome to another episode of She's in Sync, the podcast for women looking to safely transition off birth control with clear skin, zero mood swings, and symptom-free periods. I'm really excited to dive into this episode because we're going to be talking about my favorite two non-hormonal birth control options for women who want to get off of birth control, but they want birth control. And that on a personal level was me when I decided to stop hormonal birth control after realizing all the negative side effects of it, that it was making my acne worse and it wasn't giving me a true period. I didn't want to get pregnant. And it was important for me to have a method that I felt confident in. So today I wanted to dive deeper into that because that's something that I hear a lot from women who message me who maybe have some fears around stopping hormonal birth control because they are at a place where they don't want to get pregnant and they don't really know what their options are. So before we dive into that, two things. The first thing I want to say is just a quick disclaimer. This is for educational purposes only, and please work with a medical professional to determine which option is right for you. And I wanted to start also with my question of how I'm nourishing myself recently to inspire you to think about the same thing or maybe how you need to nourish yourself better today. So my example of how I'm nourishing myself recently was this past Saturday. You know, when you just have those weeks where you're like, I just am in a funk physically, mentally, it was just one of those weeks. And so when the weekend rolled around, I just really needed to do some self-care. And so how I did that was I cleaned the house and I did my part of the cleaning. Jared helps me, but I did my part of the cleaning. And as a background, my part of the cleaning is the majority of the house, but he does the bathrooms because I hate doing the bathrooms. So that's our deal. So when I do my part of the cleaning, even if the bathrooms aren't cleaned yet, I feel so much better. There's something just about being in a clean house that's so helpful and just like helps me relax. Not that you always have to have a clean house. Obviously, that's something I've been working on is being flexible with that and not having that dictate everything. If I you get what I'm saying. So I cleaned the house and I actually said no to going out with friends. We got a text that morning. Our friends were going to a local winery and they asked if we wanted to go. And we also had like a busy day. So in addition to cleaning, I was going to Costco and just had some other work and non-work related things. I wanted to do yoga, I wanted to shower, use my sauna. And I was just at a point where I was like, I want to get these other things done. Like this is going to make me feel better. So I actually said no and I stayed home and I did all my things and I felt really good. And this is a really good example of how setting healthy boundaries and saying no sometimes is the best decision. Other times it's saying yes. Maybe sometimes it's saying yes when you do have a dirty house or when you have to go to Costco or it's skipping your workout because you know going out with friends will make you feel better. For me, it was the opposite this weekend, but it's important to figure out in that moment what that's like for you. So if you're someone who tends to say yes to everything or you have difficulty saying no or you feel guilty if you say no or like you're letting someone down, I encourage you to just do some introspection of like, what's going on there? Why do you feel like that? And if you need to set healthy boundaries, I would encourage you to look into that because sometimes that's what you need to do to feel better. All right, let's dive in. So let's talk about why non-hormonal birth control is important to some people. So a lot of times women experience, and I kind of preface this at the beginning of the show, but a lot of times women experience side effects from hormonal birth control, including mood swings, weight fluctuations, low sex drive, anxiety and other mental health struggles, digestive issues, acne, all these types of things. And they want to come off birth control, but they're scared of becoming pregnant. And I totally get it because, like I said, that was me. So I'm going to be talking about two options that I really like to educate clients on so that people can make an informed decision on what's best for them. But that's a big reason why a lot of women want to come off hormonal birth control because they feel like the hormonal options are not serving them and they're not feeling good. And or maybe they just want to come off and they want to reconnect to their body. They want to track their cycle and cycle sync. That's something I'm hearing more and more in discovery calls and in conversations with clients is they want to become more connected to their body. And I think that's so amazing and so empowering as women because a lot of times with birth control, we're really disconnected, and just in society, we're disconnected from our bodies and our femininity. Great. Femininity. Is that a word? Our feminine side. Maybe you want to get to the root cause of your hormone symptoms. So maybe you're someone you were put on birth control for a reason other than pregnancy prevention. For me, it was getting my period back. For some people, it's acne. For some people, it's PCOS or painful periods, for example. And the thing with this is the hill that I will die on, is that these things, birth control isn't fixing these things. Birth control is masking these things because it is flooding your body full of higher doses of artificial hormones that don't act the same, which is where a lot of women have negative side effects from being on birth control. So there's a variety of reasons why you might want to come off of birth control and why you're looking for non-hormonal pregnancy prevention options. The first thing I want to go through is option number 1, which is called Fertility Awareness Method. So Fertility Awareness Method, called FAM for short, is where you track different signs of fertility. And the 3 key fertility signs are basal body temperature, or BBT, cervical mucus, and cervical position. And basal body temperature, to dive into all these things a little bit more, basal body temperature is you're at your lowest resting body temperature first thing in the morning. So you take your temperature first thing in the morning and you have to track it pretty religiously. So FAM is definitely for someone who is willing to put in the work and to learn it and to track. But then once you do that for a period of time, it becomes easier. So it's kind of like learning to ride a bike. You put more effort into it up front to learn it, and then it gets easier. You can kind of just be more in tune and hop on the bike, hop off the bike, and it's easy breezy. So you have to use a digital thermometer, and you have to take your temperature in the morning, even before you get up to pee or eat or drink anything, because it's really, really important for this to be pretty spot on, because you're measuring your body temperature to show when you're ovulating. So when you are ovulating, your temperature rises. So you're tracking that to know when you're ovulating. And if you don't know when you ovulate, this is when you will get pregnant if you're not on birth control or using protection. This helps you see that window of a couple of days when you're ovulating. So that is when you don't have sex or you use an alternative birth control method like condoms. So tracking basal body temperature, you can do that like paper, pencil, just taking your temperature, tracking it. This is what I did when I was first learning it. Or there's different apps as well that you can do this. The next marker is cervical mucus. Cervical mucus changes throughout your cycle. If you haven't noticed this, it's pretty cool. And this is actually something, again, you'll start to recognize these things and you'll start to see it more and more often the more you become aware. Before, I didn't know anything. I didn't recognize any changes in cervical mucus. And now I'm like, oh, I must be ovulating. Oh, I'm in my luteal phase. It's pretty cool. So your cervical mucus helps sperm survive and travel to the egg. So when it's more dry or sticky, these are your infertile days. So this is like right after your period. There's little to no mucus present. And when it's this egg white, stretchy, clear, slippery consistency, some people refer to it as like an egg white, that's peak fertility. So that's when, if you want to get pregnant, you should have sex. If you don't want to get pregnant, you should avoid sex or, again, use an alternative method. How to track cervical mucus? Again, you can just look via wiping when you go to the bathroom. You can record changes in a chart or an app on paper. This is something that using these 2 is what I recommend for clients. So the more markers you use for FAM, the more accurate it's going to be. So if you're just tracking basal body temperature, for example, it's not going to be super effective. You're at a greater risk of getting pregnant. Versus if you use BBT and cervical mucus together, then it's going to be more, the accuracy of not getting pregnant is going to be higher. So this is where you have to put more work into it to learn it and to just become more aware of your body's signals. But that has pros to it too, like reconnecting to your body, starting to be more in tune with your body, which I think everyone can benefit from. Cervical position, I'll briefly go over. This is one that a lot of people are not as much of a fan of because it literally involves checking the height, firmness, and openness of your cervix throughout your cycle. So it does require you to get a little down and dirty, but it can be useful if you want to use all three of those methods. So there's a really good book called Taking Charge of Your Fertility. It talks all about the Fertility Awareness Method. That would be a great one to look into if you want to dive into FAM. And there's also lots and lots of coaches out there who specifically focus on and help teach FAM to women and partners of women. If you want to get pregnant, you can use it. If you don't want to get pregnant, you can use it. So it's a very cool method. And I'm actually planning on having a FAM specialist on the podcast in the future to chat more about this. So with perfect use, it's 99% effective. Typical use is about 75 to 98% effective. So it really depends on your consistency, how many markers you're using. Let's move on to the Copper IUD. So the Copper IUD, also called Paragard, is my non-hormonal birth control method number 2. And this is what I personally use. This is when I was transitioning out birth control, I was not connected to my body. I had no clue about FAM. And it sounded way too risky. So the more and more I learned about FAM, the more I'm like, oh, this is okay. But when I first started, it was scary. So I decided to go with the Copper IUD. How this works is that it is copper, obviously. And copper prevents sperm from fertilizing the egg. Basically, copper repels the sperm. And it's over 99% effective. And this is a pro of it is that you set it and you forget it. But there are risks to it. Because some women, and this is one thing I test with my clients, are their copper levels. Copper can rise with hormonal birth control because you're getting artificial estrogen in your body. Estrogen and copper have a synergistic relationship, so oftentimes they rise together. Not everyone, though. So it's really important to, before getting the Copper IUD, to check your copper level to make for sure you don't have too much copper in your body. Because if you do, copper is inflammatory. It's an essential mineral, but it's inflammatory if you have too much. And so if you get the Copper IUD, that's more copper in your body, and that can cause painful, heavy periods. It can make acne worse, cause mental health issues like ADHD or anxiety, depression. It basically can just make things worse. So this is where being really proactive and working with a specialist like myself to do some deeper lab investigating before coming off birth control can be really helpful because it can also help you make an informed decision of which non-hormonal birth control option you would like to choose from because you have that lab data. The Copper IUD is something it typically lasts. When I got mine, they said it lasted about 8 to 10 years, I want to say. So it is a really helpful option if you again, want to just get something and not worry about it. So it doesn't have that learning curve, obviously, like FAM does. Do you prefer daily tracking or one-time procedure? How comfortable are you with potential side effects from the Copper IUD, especially if you're not planning on working with someone to double check your lab values versus tracking FAM? So recap of key points. There are really good options for non-hormonal pregnancy prevention when you decide to stop birth control. It just depends on which option is best for you and which one is the best fit at this time. So there's FAM, the Fertility Awareness Method, which is monitoring 3 key fertility signs: basal body temperature, cervical mucus, and cervical position. The more of those you monitor, the more effective it is at preventing pregnancy. But it does have a learning curve and it does require some tracking, but the pros are you become more in tune with your body. And if you want kids down the road, you can use it the exact same way for tracking when to try and conceive. So it's multifaceted. If you're someone who wants to have something placed and forget about it and be good for a period of years, then the Copper IUD might be good. However, the con of that is it could make things worse if you don't check your labs ahead of time to make for sure that you don't have high copper or other complementing nutrients that help support copper detox. So just know that there are options for you and you can make an empowered decision about what is the best fit for you. If you want some additional resources, or if you want any FAM providers who I have personally connected with and would recommend, feel free to DM me on Instagram and I'm happy to connect you. Until next time, stay nourished.